Hello, everyone, and welcome to today's UMD Prevention Research Center webinar. My name is Em. I'm a PhD student in counseling psychology, and I am the graduate assistant for research and scientific communications with the center. I am very excited to introduce Samantha Moran, a doctoral student in the Department of Family Science here, who is joining us to talk about work co-authored around gender affirming care with the American Association of Medical Colleges Center for Health Justice. Lots of words, and my handwriting is illegible, so I was running through that. But we're really excited to hear about this really crucial work in a time of really severe anti-trans sentiment and legislation. And we're very excited to hear about the critical research into this area and the importance of affirming actions for these communities to address mental health and other disparities and seek a world where human rights and dignity for trans communities are realized. And so if you could advance to the next slide, please. A few practical things before we begin. This meeting is being recorded and will be shared via the UMD School of Public Health YouTube page. There you can also see other episodes of our or other webinar series, other times that we've done this webinar series, and see sort of other topics relating to LGBTQ health equity as we've had a variety of speakers come through. And so that's openly available there. Please share it, subscribe, all those fun things. We ask that you submit your questions using Zoom's question and answer feature. It should be part of the bottom of your screen, the settings there. Additionally, closed captioning is also available through Zoom's automatic live captioning feature and can be activated in your settings. So with that, I'm going to pass it on to Samantha to begin your talk.
All right, thank you, Em, for that wonderful introduction. As I stated, my name is Samantha Moran. I use she, her pronouns. I'm a doctoral student in the Department of Family Science at the University of Maryland. I do have clinical training and background as an LMSW, so I bring a little bit of a clinical lens to my research. I am a graduate research assistant in the SOGI Health Research Group, and very broadly, my research interests include sexual and gender minority youth in the school context. So inclusive curricula, what is their perception of school climate? What is the availability of teacher supports? And I'm also interested in access to affirming care and supportive services for LGBTQ plus individuals. And there's also a link to my full bio. I don't know if everyone gets access to these slides. Okay, so today I will be presenting a policy brief that was done in collaboration with the PRC and the Association for American Medical Colleges Center for Health Justice. The title of this brief is to protect evidence-based medicine and promote health justice, protect gender-affirming medical care. So this work really would not have been possible without our lovely team of collaborators. Myself and Dr. Bishop at the PRC, along with our colleague at The Ohio State University, served as the subject matter experts for this brief and helped drive some of the project management. We also had several key members from the AAMC listed here. They helped facilitate the project leadership and management, and they also had a number of individuals with a unique set of skills. One team member was a librarian who helped with the reference checking for this brief. We had a couple of members who were involved with policy and advocacy or were lawyers, so they helped us really piece through this policy side of this project. So this really was a multidisciplinary team effort. So the why behind this project is, as Em stated, there has been an unprecedented surge in the 2023 state legislative sessions aiming to restrict access to gender affirming medical care, or GAMC, for minors. If enacted, these bills will limit access to medically indicated healthcare and exacerbate health and mental health inequities for transgender and gender diverse youth. I put a note there because a lot of the language in these bills are specific to transgender youth, but these bills have similar implications for gender diverse youth, so youth who might identify as non-binary or gender fluid, Really, any youth who seeks access to gender affirming medical care will be impacted by these bills. This experience is not just specific to transgender youth, even though a lot of the language indicates that. So a total of 474 anti-LGBTQ bills were introduced in the US 2023 legislative session. This is more than double of what we have seen in the previous year. The graphic on the right, though it's already outdated from April 3rd, shows us this like rapidly progressing wave of anti-LGBTQ legislation that is being introduced in the last 5 years. I also apologize for my neighbor's dog barking. So this legislative and other policy efforts that are restricting gender affirming medical care really jeopardizes this really sacred doctor and patient relationship and undermines this premise that physicians are trained and qualified to work with patients and their caretakers to make evidence-based and medically appropriate decisions. So the aims of this project really were to determine the number of transgender youth in the states where these restrictions and bans on gender affirming medical care have been enacted or passed. So seeing X number of youth in Y states will be impacted by anti-GMC legislation. We also wanted to outline the need for gender affirming medical care and the harm if this is inaccessible. And we wanted to disperse this critical information to politicians and lobbyists to further influence policy decisions. And we also wanted the general public to have access to this document to clarify any misconceptions of gender affirming medical care, inform them about the current state of this legislation, influence advocacy efforts, and really highlight the need for additional resources and support that are relevant to this community. All right, so the topic here are transgender and gender diverse youth. Data from the Williams Institute indicates that there are over 300,000 adolescents ages 13 to 17 in the United States who identify as transgender. That's about 1.4% of this adolescent population. Again, I make a note that this number is an underrepresentation of the population in question, as it doesn't include other gender diverse or non-cisgender identities. Transgender youth are youth whose gender identity or innate sense of their own gender is different than the sex that they were assigned at birth. So relative to their non-transgender peers, i.e. cisgender, transgender youth are at elevated risk for mood disorders such as depression, anxiety, and suicidal behaviors. That includes suicidal ideation and attempts. They are at elevated risk for their mental health risk is elevated, and this is associated with their experiences of gender-related stigma, so rejection, bullying, or discrimination, and that is related to gender dysphoria, or is exacerbated by gender dysphoria, which refers to the persistent psychological distress that arises from that incongruity between your gender identity and your external physical traits. So really how the world sees you versus how you see yourself. To cope with these negative experiences in mental health, transgender and gender diverse youth often use substance use and self-harm as negative coping mechanisms. And evidence suggests that around 35 to 45% of high school age transgender youth considered or attempted suicide in the past year. This is double the rate of their cisgender peers and really highlights how profound these mental health inequities are. So what is GAMC? As noted, gender affirming medical care. What this looks like is for prepubescent adolescents, gender affirming care can consist of support for social transitions, such as changes in name, pronouns, and appearance, so hair, dress, accessories, and use of traditionally gendered spaces, such as bathrooms and locker rooms. Around puberty, adolescents and their caregivers may consider gender affirming medical care in consultation with medical and mental health providers. Gender affirming medical care may include the use of medications for pubertal suppression. So this will create a temporary and reversible pause in the development of secondary sex characteristics, so changes in voice, body composition, and body hair that are often misaligned with an adolescent's gender identity. So following pubertal suppression, some adolescents, along with their parents and clinical providers, may opt to receiving gender-affirming hormone therapy, which is the administration of testosterone or estrogen, and that will induce the secondary sex characteristics that align with their gender identity. A huge misconception is that parents and children are walking into a doctor's office and immediately being prescribed hormones. This is not the case. This process takes a lot of time. It takes a lot of evaluation, a lot of conversations, and verification from numerous different providers, indicating that this is the appropriate level of care. And I think that's something that's really lost around the harmful discourse around this level of care. So there's a lot of evidence that supports gender-affirming medical care as an effective strategy for improving transgender adolescents' mental health and well-being. There is extensive peer-reviewed medical research that indicates that gender-affirming medical care is associated with improved mental health and psychosocial functioning among transgender youth. In studies that followed transgender youth over time, those who received gender-affirming medical care in the form of pubertal suppression and or gender-affirming hormones reported decreased depression, anxiety, body dissatisfaction, gender dysphoria, and suicidality. They also reported improved psychological functioning, life satisfaction, and quality of life. And this is all in comparison to other transgender youth who are interested in gender-affirming medical care, but were not able to access it. In a recent study, after receiving gender-affirming medical care, the subjective well-being and quality of life for transgender youth were comparable to same-age peers from the general population. Another study found that rates of suicidality among transgender youth receiving gender-affirming medical care mirrored those in the general population, whereas transgender youth who were referred to gender-affirming medical care but had not yet received it reported elevated rates of suicidality. Transgender youth who receive social and medical support to affirm their gender identities show rates of depression and suicidality that are comparable to youth in the general population. So this really highlights how this level of care can help bridge some of the disparities in mental health between transgender and gender diverse youth and youth in the general population. Okay, so there are 29 major medical organizations that recommend and support gender-affirming medical care. Some of them are the American Academy of Pediatrics, the American Medical Association, the Endocrine Society, the American Academy of Child and Adolescent Psychiatry, and the APA, the American Psychiatric Association. Gender-affirming medical care is evidence-based clinical care, and the support and provision of medical insurance coverage supports medical insurance coverage for gender-affirming medical care. So this all highlights that gender-affirming medical care is developmentally appropriate despite these narratives that are in our legislation and medically necessary for youth who meet internationally recognized guidelines for treatment. So our policy brief was published mid-March. So as of March 8th, the state of the legislation was that there were 30 states that have proposed or enacted legislation that would ban and or criminalize gender-affirming medical care for adolescents and young adults. If passed, this is a conservative estimate that would include more than 132,000 transgender youth, which is about 1/3 of all transgender youth in the United States, would lose access to the availability of this clinically recommended and life-saving healthcare. As of March 8th, already over 20,000 transgender youth across 7 states are impacted by anti-gender affirming medical care state legislation. However, since this brief was published on March 13th, there are also 3 other major national organizations that published similar reports within the next couple of weeks. To our knowledge, these are the most up-to-date briefs that have come out. The latest one from the New York Times was as of April 15th, stated that there are 10 states that have banned access to gender-affirming medical care, and this impacts over 53,000 transgender youth. And this is just a map here, again, of the legislation as of March 8th. You can see here the states and the population of transgender youth where gender affirming medical care legislation was introduced or enacted. So we can see the darker purple are states that have a higher concentration of transgender youth that will be impacted by this lack of care. So I'm just going to leave this up for a minute for everyone to review. So the methods for this brief, this was a secondary analysis of the prevalence of transgender youth in states where anti-gender affirming medical care legislation was occurring. So this is a research review summarizing the potential mental health impacts of the proposed legislation. The prevalence rates of US transgender adolescents were estimated by the Williams Institute, which aggregated data from the YRBS, which is the Youth Risk Behavior Survey. States that proposed or enacted legislation to prohibit GAMC for youth were any states that enacted any anti-GAMC legislation targeting youth or that proposed legislation in the 2023 legislative sessions as of March 8th. And this legislative data was retrieved from 4 web-based transgender-specific legislation trackers and a tracker developed by the American Civil Liberties Union. So it's important to note that the language in these bills are really sneaky and differ across states. In some states, the language on these bills is just very simple. It restricts access to care altogether in the public or private sectors for any transgender minor. Some bills restrict care through legal punishment of providers who do provide care. So technically, while this care is available, providers will be professionally sanctioned if they're found to provide that type of care. Other states restrict care by enacting criminal charges or allegations of child abuse or neglect if parents are found that they are engaging in this type of care for their child. And also some bills specifically target health insurance plans, so limiting their health insurance plan's ability to cover healthcare that is considered to be gender affirming and supports gender affirming medical care. So there are several implications of these types of policies. When we limit or ban gender affirming medical care, this exposes transgender youth to a lot of short and long-term social and mental health impacts of unmitigated gender dysphoria. We are likely to see an increased risk of suicidal behaviors. Again, that's ideation and attempts, increased of negative coping mechanisms such as self-harm, an increase of other forms of violence, victimization. States that enact these policies are likely to observe an increase in the number of youth who experience suicidal thoughts, engage in self-harm or other suicidal behavior, and will require state funds for clinical and mental health services, which is a consequence that the United States is not equipped to address due to this longstanding shortage of mental health professionals. So here we have another map of the mental health professional shortage in this country. It would be nice to have the 2 maps kind of mirrored each other, but where you can see where there is a higher shortage of mental health professionals are the states that are enacting anti-GAMC legislation. So again, I'm just going to leave this up so everyone can give it a nice review. So some implications for professionals, what can you do? So being aware of your current policy climate in your state, I don't know if everyone here is joining us from Maryland, but we do have a lot of protective policies in place for this population. But if you happen to live in another state, it's really critical that you are aware of this policy climate and the implications that has for anyone that you might work with. If you are a mental health professional, I know I don't need to tell you this, but it's important to really validate these distressing feelings, concerns for safety, concerns for their future. Understandably, this could be a really unsettling time for transgender and gender diverse youth, especially if seeking gender affirming medical care always seemed possible and was a plan for the future. It's important to assess their current level of support with their family, peers, and community, and to have those discussions about that support or lack thereof, and what that means for them, what that means for their identity development, and what that means with how they engage with their community. Can provide resources for local organizations or events that are transgender affirming or welcoming. I know a lot of states and communities have kind of local pride centers that might have events. A lot of these centers do maybe like clothing swaps, so youth are able to kind of access more gender affirming clothing without having to pay for it. And you can also help problem solve a bit and see what are the barriers to care. Is seeking gender affirming medical care out of state an option? That's obviously very timely. It's very costly. There might be insurance issues doing that, but just really working with youth and their families and seeing what are the options and what is available to them. And that is it. This went a lot quicker than I thought. So I do apologize for everyone who thought we were going to be here for the full hour. But I think we're going to open this up for some Q&A.
Yeah, definitely no need to apologize. Thanks for providing such a succinct overview of this really important work, I think, regardless of the time. You excellent job communicating all of the different elements of this and summarizing the brief and also pointing out how, yeah, people in this field or even and allies to the community can begin to um, support trans youth and fight for better structural change. And so reminding the attendees to please use the webinar Q&A function that's built into Zoom to ask a question. Um, but as we give people a moment to do that, one thing that I personally, as a trans person, this climate doing this type of work myself as well, I always like to ask folks who are also sort of in this area about, in the face of all of this, what provides sort of hope for you, or what do you hold on to, if anything, in the sense of like where we can find strength, resilience. Not that we acknowledging also that's unfair that the expectation is resilience in the first place, but like what sort of brings maybe a spirit of radical hope maybe to some of the things that you're involved in.
Yeah, that's a really great question. I think in the wake of a lot of this, harmful legislation, and we're seeing it rapidly increase over time. I think it's increasing over time because there is such increased visibility. And I think that that's really important. Unfortunately, I feel like as people in positions of power are kind of seeing what this community is doing, what they are capable of, and all of the wonderful things that they are engaged in, it's kind of adding fuel to their own political agenda. But I think it's important to note that we're in such a time where there is a lot of support, there is a lot of acceptance. We want this community to be visible and to share their experiences and to connect with each other. I think unfortunately, as the more that grows, the more kind of we're going to see these kind of harmful policies. But I think that we need to hold on hope that, in the wake of kind of, you know, this kind of COVID virtual meetings, we're have more outlets of connection. Social media, like we're really connecting this community with others and supports in a way that we weren't able to do 5, 10, 15 years ago.
Yeah, I think that's so powerful. The visibility, and even when it's like in backlash to it, it's a sign that like people um are reacting within a cisnormative transphobic world to the fact that people are starting to see the beauty that is within gender diversity and gender diverse experiences, and reminding us of the power of being queer.
Yeah,
Yeah.
that was a good question. So thank you.
Oh, yes, of course. We have another question from one of the um, folks in the audience that asking a little bit more about the maps that you showed and the coding. So a little bit about how, like, the concentration of mental health providers, and then um, I guess the other map about trans, how many trans folks are in different jurisdictions.
Yeah, so I'll start with this map. This map is using the data from the UCLA Williams Institute. So this report breaks down how many youth in each state identify as transgender. So we mapped that onto this map and highlighted the states where anti-GMC legislation was introduced or enacted to kind of aggregate this number of the total number of youth who are at risk for losing this type of care. And then for the mental health professional shortages, this actually is a map that we got permission from HRSA to use. So the higher the HPSA score is the higher need for mental health providers. So the higher the score means there's a higher need of mental health providers because there is a shortage in that area.
Hey, thank you for sharing a little bit more about those graphics. We have another question from an attendee. What recommendations uh, do you have when speaking in policy spaces and or with elected officials about these topics?
Yeah, I think that's a very good question. I think it's really important to, in these spaces, kind of help understand the harm. I think a lot of these, any anti-LGBTQ bill is really this kind of underlying message of like we must protect the children, like we must protect children through education. And it's important to note in these spaces that this is protective, right? You are protecting transgender and gender diverse individuals with this type of care. We are protecting LGBTQ youth when we do have inclusive curricula and education and access to these supportive spaces. So it's important to note that these are protections. They may not be protections in their mind, but we do have empirical data highlighting that these are supportive measures and that there is such a disparity in mental health between transgender and gender diverse youth and youth in the general population, and that this is a mechanism to help bridge that gap. And by removing this type of care, you're just going to widen the gap and create more exacerbated mental health outcomes for this population.
Yes, definitely. Like flipping sort of the narratives that are grounded in transphobic assumptions about what protection means, and uh, being able to recognize that um, we have the evidence that gender affirming care um, allows people to live more authentic and um, positive positive lives. So, um,
And if you don't need it, you don't have to access it, right? We don't need youth who we're not, forcing this type of care on youth that don't seek it. I think that's also a really big misconception that once it's available, like I said earlier, people can just walk in and get it. There are processes in place that prevent that. It's even in states where this level of care is available, it's still very hard to get and it is very time intensive and it can be very costly. So we're not just kind of forcing this on everyone. And I think that is kind of drives a lot of the narrative around these policies.
yeah, sort of going off of that and the previous question, this another member of the audience asked this, and I think it speaks to me as someone who does a bit in science communication and wants to like think more about how my own work translates to policy. But as um, so the attendee asks, as someone who is invested in getting science into the hands of policymakers, do you have any ideas about how a brief like this might influence practical policy decisions, even in some of the debates that I guess you've seen in the few weeks since this came out?
Yeah. I think the brevity is really important in sharing this type of information, especially in policy spaces. To share this type of science, it really needs to be clear. It needs to be concise. It needs to be to the point. I think just like having those hard hitting points is going to have a better chance at enacting change. There's obviously probably hundreds of like really long empirical articles that go into great detail on why this is important, why limiting this type of care is going to be harmful. But when you're getting this in the hands of politicians, it's really important to just like keep it clear, keep it concise, like get your hard points out there so that they can just have the information that they need and not get kind of swept up in maybe those finer details that are a little more profound for us that are in the field, but maybe not kind of like relevant to their own agenda. They just need the facts.
Yes. And um, yeah, just sitting with the moment. I think yeah, it's so important to that. Like when we are in our like science environment, like all the jargon and theory that comes up in the work that we do, but then wanting to translate into policy or disseminate to the general public, like it requires that thoughtfulness with what what do busy people need to communicate to receive accurate information about our communities and our experiences and try to translate that. So thank you for sharing that.
Yeah. And that was kind of a really big guide throughout the process of creating this brief was, you kind of have academics on one hand, and we have people who are more involved in policy spaces, and the writing style is very different. So we just had a very clear goal of like being very objective, not really being emotional, just kind of limiting the amount of jargon because that's kind of how you lose people who are accessing this information. It needs to be clear for anyone who reads this, despite what background they have.
Definitely. Um, and I am curious, just having a conversation. This is my own question about like, have you or any of your co-authors sort of been involved in engaging with policymakers directly on this? And I am curious, like with the heated sort of ways that anti-trans rhetoric manifests, I wonder, are there times where you've encountered people maybe not being too compelled by facts, and do you have advice for people navigating difficult conversations where even the consensus of all these medical organizations isn't sufficient to convince them um, that being gender affirming is the correct way to support trans youth and communities?
Yeah, that's a really great question. I would imagine that some of my co-authors probably have more experience with that as they've had more experience in the field. Me personally, kind of being a new student and kind of newer to this space, I haven't necessarily encountered a situation where, someone who I was kind of talking to these issues about didn't necessarily believe in it or get it. I think that being in the Department of Family Science, like everyone is really agrees with this mission and agrees that this is important and medically necessary healthcare, and that we are supportive of sexual and gender minorities. I think that engaging more with kind of like broader public is a goal of mine, and just a goal of a lot of my peers and collaborators, that it's really important to like get out there and put ourselves in these intentionally in these spaces to have these conversations and to help others who are less aware of the science what our mission, what is important to us, what are the harms of, some of the policies that they are enacting or suggesting.
Yeah, thank you for exploring that a little bit with me, and I appreciate your the thoughtfulness around like, yeah, I think for me also being at the University of Maryland and experiencing similarly that people um are supportive and affirming and agree in the importance of this as affirming care, like I find that support to be really critical. And I also grapple with like what it looks like to and what it will look like in my work to like try to translate that and have difficult conversations and still seek better conditions for the community, even when and if people don't um, fully see or empathize with the perspective, and also recognizing the ways like structural transphobia influences who has power in those conversations. Yeah,
Yeah. I think that's a good point. Sometimes it can kind of feel like an echo chamber, like you're providing information to people who already know it or are supportive. And I think it's really, you make a good point of kind of like branching out so it can really make, those structural changes and kind of change a lot of the narratives around this community and the needs of this community.
yeah. And that ties into another question uh, from one of the attendees. Sorry, I keep forgetting words, but um, someone asked about, you alluded to the protective policies currently in place in Maryland specifically. Could you speak a little bit more about that?
Yeah, so in the state of Maryland, they actually codified access to gender affirming medical care through Medicaid. So that really allows us to have people who have Medicaid be able to access this type of affirming healthcare without it being stripped away from them. As mentioned, there are policies that are trying to limit the ability for health insurance plans to cover this type of care. And in Maryland, this is protected.
Yeah. Um, Thanks for sharing a little bit more about that. I think I also follow our like state legislative coverage, and I think it's really, um, yeah, knowing the specific things within our jurisdiction can be beneficial to providers, and also as folks support people in their own jurisdictions, like trying to figure out where things are at. And I think some um, like some fields taking more of a practitioner advocate approach to things, like being able to advocate for the needs of your clients or patients, depending on your field. And on that topic, someone asked if you're seeing, and Maryland's legislative session ended recently for those who might not know, but are you seeing any sign that Maryland may become a sort of safe haven? Like there's some legislation around that area that for like protecting people as they cross state lines for this purpose. Do you see any evidence of that being the case for Maryland for out-of-state trans youth seeking care?
That's a good question. I think there's a possibility, but given kind of like where Maryland is situated on the East Coast, we're not necessarily, very close to a lot of these other states that are pushing, a lot of this anti LGBTQ policies. So I feel like we're kind of very close to a protective bubble. But I do think as time goes on, it is very possible that as a very, progressive state, that we can see, more people seeking residency here or seeking care in the state.
Yeah, and I guess that will be an ongoing point of research even for people, like tracking the trends and seeing um, what the longer impacts are in this ongoing sort of
Mhm.
like policy, um, ever changing like policy situation. Yeah. Um, One attendee asked a question about sort of our own campus climate here at the university, and noticing that pronoun usage by cis folks is experienced by this attendee as much less common now than even a few years ago, almost, and I'm interpreting, but like that the maybe it's becoming less common, or people are being less proactive about using pronouns as if they're cis. Do you feel like there's a need for cis people to use pronouns to support and show solidarity with non-binary and trans communities? And if so, do you see sort of university level resources or actions being needed or existing to increase usage in those areas?
Yeah, that's a really great question. I think absolutely it is, the responsibility of cis people to use pronouns, to use kind of gender neutral language like my partner, when referring to your significant other. I think this helps protect people who, might not be cisgender, right? They're not automatically outing themselves by using their pronouns. If everyone uses their pronouns, then, by them not being the only person in a classroom or in a conference room, it's kind of keeping them safe. So the more that we normalize use of pronouns and kind of gender neutral language, I think it helps protect gender diverse individuals, and not kind of automatically out them in a situation where they might not fully feel safe. I do feel like the university is kind of increasing the visibility of support for LGBTQ individuals, even outside of the PRC. So I do see kind of more of a push for people in positions of power, even faculty members, to really enforce the need for this type of language, kind of on like a broader school level.
Yes. Thank you so much for for sharing about that. I think as someone who's been part of the university community for several years, you see sort of the waves of advocacy and activism from trans communities, and also efforts like as um, and all that, like within a larger social context that of course we are discussing right now, and so thinking about the different ways that elements of that manifest, and what ongoing efforts can we do within our local communities to create safe environments in higher ed, in other fields, to sort of be responsive to maybe like these sorts of trends that we're talking about here, larger like actions around structures, and bringing or trying to sort of codify transphobic ideas, and block access to care, and understanding that there's also an area of literature looking at like mental health impacts of even the fact that the legislation is being considered at all and the rhetoric is being promoted. And so understanding that you don't have to live in a jurisdiction that directly is uh, really considering this legislation to be impacted by it.
Yeah, that's a really great point.
Um, I think I've cleared the Q&A. Are there any other things that you'd like to share, sort of words of um, hope, or thoughts about what you want, like major takeaways to be from the work that you're engaged in, or ideas about what the future is going to look like for work in this area?
Yeah, thank you. Well, I just want to thank everyone for joining me here today. This is my first webinar through the PRC, so definitely very new to me, but still very special. I think moving forward, this kind of in the wake of all of these harmful policies, I think it is just really important to note that like being inclusive to the LGBTQ community, it impacts everyone. It doesn't just impact individuals who do identify as a sexual and gender minority. And the more that everyone, whether you're in the community or not, can really accept that and lean towards affirming these individuals and kind of normalizing the experiences, the fights of this community, and just kind of this gender neutral language will help us kind of create just like a more inclusive environment without it being seen as something that's dangerous. I think that's just such a big discourse, is that the more that we're inclusive, it's dangerous and it's pushing kind of this agenda. But the more that we show that it's not dangerous, it actually creates a sense of safety and a safe a sense of connection for everyone is really important in a lot of the work that I do moving forward, and that I'd like to see others do moving forward, is kind of this just like normalizing of, you know, the experiences of these individuals, and being cognizant of these disparities and what are the mechanisms that help bridge some of these gaps.
Yes. Well, thank you so much for those words. Thank you so much for joining us and for sharing this really important work, and for helping folks to learn more about how we can support gender diverse communities in accessing gender affirming care. And to our attendees, to our audience, thank you all for taking the time out of your Tuesday as well to join us for this. And yeah, take good care.
Thank you.